Hello, I'm Dr. Joel Hoffman with North Atlanta ENT and Allergy, and today I'd like to talk to you about balloon Eustachian tube dilation. The Eustachian tube connects between the middle ear and the back of the nose, called the nasopharynx. Eustachian tube dysfunction is one of the most common problems that presents to my office. Patients complain about pressure in the ear, clicking, popping. And if the Eustachian tube actually is too open, they'll complain about echo sensation when they talk. Traditionally in the past, the options to treat patients with Eustachian tube dysfunction was either conservatively with medicine, treating their allergies with antihistamines and decongestants. If that didn't work and the patients were still quite bothered, the next step would be an in-office tube in the ear. We under local anesthesia, numb up the eardrum and make a tiny incision in the eardrum under the microscope. We place a tube in the ear which helps aerate the middle ear and give the patient relief from this problem. The downside to the tube is you have to be careful with water. If water gets into the ear, it can cause an infection with drainage. We have to treat that. And also, the other thing I found out the more I was doing this procedure over the years, afterwards patients often complain about a little bit of a hearing loss, which sometimes doesn't go away till the tube comes out. The tube stays in for approximately 1 year and falls out on its own, and if patients are still bothered, we have to go back and replace it. The newer procedure with the balloon Eustachian tube dilation, what we're doing is passing a balloon through the nose into the nasopharynx, the back of the nose side of the Eustachian tube, and actually passing the tip of the balloon into the Eustachian tube and blowing it up and then withdrawing it. And it's expanding that opening to improve Eustachian tube function, and then patient gets long-term relief. They don't have to worry about water precautions, and the procedure is an in-office, easy procedure that's very well tolerated. Eustachian tube dilation is an excellent option for patients in the aviation industry, business travelers, patients who scuba dive frequently, and it's also a better option for most patients who just generally have Eustachian tube dysfunction, who would normally be a candidate for tubes. The procedure is done under local anesthesia. We place a topical anesthesia in the nose to numb up the nose, and we'll spray the nose. And once they're numb, the guide wire and the balloon is passed through the nose into the back of the nose, called the nasopharynx. The balloon is advanced into the proper position and then insufflated to a certain pressure and withdrawn, which dilates the Eustachian tube and opens it up. Recovery patients do quite well. The next day they can go back to work. It's not a painful recovery. We'll tell them to take Tylenol. Typically we'll take care of the pain post-operatively.
Inflate the balloon up to 12 atmosphere.